Welcome to Freethought Matters. I'm Annie Laurie Gaylor, co-president of the Freedom from Religion Foundation. On today's program, our guest will talk about the intersection of religion, abortion, maternal health, reproductive justice, and how it affects Black women.
The Freedom from Religion Foundation, which produces Freethought Matters, is the nation's largest association of free thinkers. That's atheists, agnostics, and other non-believers. We invite you to join us in our vital work to keep our secular government free from religious influence. Become a member at FFRF.org or ask for a complimentary copy of our newspaper, Freethought Today. Freedom depends on freethinkers. Watch prior episodes of Freethought Matters on FFRF's YouTube channel.
Would you be surprised to learn that the mortality rate for Black women in the United States is 3 times higher than for white women? Our guest is an expert on this topic, Tiffany Green, an assistant professor in the Department of Population Health Sciences and Obstetrics and Gynecology at the University of Wisconsin-Madison. Dr. Green's an expert in the timely issue of reproductive equity. You've seen her interviewed by national news, including MSNBC, the New York Times. Thank you for coming on Freethought Matters, Professor Green.
I'm so happy to be here. Thank you for having me.
So I have a lot of questions for you about racial and ethnic disparities in reproductive health. But first, Dr. Green, could you talk a little bit more about yourself, your views on religion and humanism?
Well, of course, I consider myself to be a secular humanist. I think my research, my life, my career, the way I move in the world really circles around the fact that I think that we are all we have as humans, and it is incumbent on us to do the work to make sure that every person that's born can reach their highest potential in life, or at least to create the conditions that allow them the best chances for success.
Well, that seems like a very good definition of humanism. So, Tiffany, were you brought up religious, or did something cause you to reject religion?
Sure. I was not brought up as a secular humanist. I was brought up as a Seventh-day Adventist, which some of your viewers may be quite familiar with. It is definitely, looking back, quite a restrictive faith in a lot of ways. I would say it gave me some good foundations in terms of thinking about eating, like healthy diets, whatever that means, right? And service. But I think what pushed me out of that was really reality, for lack of a better answer. I remember one specific time when I was a young girl, and I was listening to the story of Joshua fighting the Battle of Jericho. And I think many of your listeners that are familiar with the story will remember how the sun stood still. And I'm a post-enlightenment baby, right? And I'm trying to figure out how the earth is spinning on its axis and stopping. Like, that just did not make sense to me. And I remember very distinctly trying to chew over that in my mind. There were other incidences, but I think a big one for me, and I almost hate to say this because people will grab onto it as an excuse, but my grandmother passed away. And, she was sick for about a year and she passed away. And I remember thinking how unfair it was. And I remember my pastor, good man, right, talked about this in the context of God's will being done. And I'm like, wait a second, this is random. Like, I don't know how else to explain it. It just hit me as just a random thing. And I realized that it wasn't fair, but I had to face reality. And it's not that I was angry, although I was angry about my grandmother passing, but I realized that what I had been taught, was not it. And I think my parents raised me to question things. So honestly, it's not surprising that I got to the point where I said, no, this is not, this is not reality. I mean, there's nothing more that I can say than that.
Well, like so many free thinkers, you came to this on your own, and I think that's very admirable. Having been brought up without religion myself, I didn't have to have that struggle. Did this cause any problems in your family?
My family is really interesting. I would say they still go to church. I remember one time my cousin said, Tiffany, we know you're atheist. We just don't care. So my family is just really blunt that way. There are certain other parts of my family that might not really love that, but for the most part, they respect who I am and respect my ability to think on my own. And I'm just very clear about who I am and what I am and how I'm raising my family. And that is without religion.
And you have children, and that's your recommendation to other parents.
I don't know what I'm doing. I don't think any parents know what they're doing. So check back in about 20 years, and I'll tell you if it worked out for me. But what I can say is that what I focused on is trying to raise kind, empathetic people. It's a challenge raising free thinkers. There are lots of social forces that tell them what to think and how to think, and I really focused on raising children that feel comfortable questioning me and questioning what their dad says. So they sometimes push back, and that is the quote unquote downside of raising little free thinkers, that they are going to question not only people outside of your house, but they are going to question you. And I actually think that's a great thing.
Me too. Well, and this is sort of a theme because you've called for training researchers to become better critical thinkers, to become
Absolutely.
scientists and more engaged citizens. So tell me more about that.
Yes. So the funny part is that I never did a lot of public engagement before I came back to Wisconsin. And we can talk a little bit more about that if you'd like. But when the pandemic hit, I found myself sort of in the middle of all of the conversation and science communication around COVID. And what I found was shocking to me, that people were automatically going towards biological and genetic explanations for why Black people and other people of color were more susceptible to contracting COVID, getting sicker from COVID, and dying from COVID. And I thought it was quite obvious that this was a result of social structures, the social determinants of health. And most notably racism. But what was obvious to me was apparently not obvious to a lot of people, including scientists that got on the train in journals. And I found myself speaking out against this constantly. And that's how I really jumped in hard to being a science communicator. I had done some work before that, but I think that was the moment when everything really started to expand for me in that space. And what I found is that even other scientists, we don't all know each other's areas, right? And I found that what I could bring to the table was a social scientist understanding of how health and health inequities get produced and package it in a way that's accessible to a wide variety of people. And still maintain my core values. I'm very transparent about my core values, that equity is important, that we have a responsibility as a society to provide the conditions that let people get pregnant when they want to, stay pregnant if they want to, raise their children in safety. And so you might not think, well, what does COVID have to do with reproductive justice? But it has everything to do with reproductive justice because so many children lost their parents or close caregivers. We know now that COVID is linked to preterm birth, a higher risk of C-sections, stillbirth, pregnancy-related morbidity, pregnancy-related mortality. And then not even just for people assigned female birth, people assigned male at birth, it can potentially affect sperm motility, right? This is a huge reproductive justice issue. So for me, it was a continuation of thinking about how we could use this as a moment to change how we do things and make things better for everyone, but particularly for marginalized groups.
So there's a startling statistic that you've called attention to, that childbirth is deadlier for Black women even when they are wealthy. So we both live in Wisconsin, and is it true that in Wisconsin, Black women are 5 times more likely to die in childbirth? We have a higher mortality rate. Is that right?
So that's a funny thing. We actually have a lower mortality rate for birthing people. The tricky thing is that the racial disparity is wider. So it's about a 5-fold difference. A couple of things to just think about. One is that there's a relatively small, thankfully, number of birthing people that die every year. I think, and what I want to say is that it is just a devastating. I can't even imagine the pain that families go through that experience this. And so while maternal or pregnancy-related mortality is critical, the canary in the coal mine is pregnancy-related morbidity. And so we're seeing things like preeclampsia, things like postpartum hemorrhaging. Like, that's the stuff that doesn't necessarily make the news, but that is the canary in the coal mine. That is the thing that if we intervene there, we can start moving the needle on pregnancy-related mortality. Back to your point about Wisconsin, yes, overall rates are lower, but that racial disparity is wider. And that I think is really important and indicative of the unequal social conditions that we have in the Midwest in general and our state in particular.
So you've said this is not the fact that even wealthy Black women have a higher mortality rate. This is not race, this is racism.
It is racism. I do want to give your listeners just a little bit of nuance with that paper that came out talking about wealth and pregnancy-related mortality. The great thing about that paper is that in general, those of us who do this work use vital statistics data, birth records, to look at the relationship between self-identified race and various outcomes. The challenge is that those data are a census of all U.S. births, but they don't contain really relevant information like income, believe it or not. So we're forced to proxy for income using things like educational status, and later there are data added on what kind of insurance someone has and whether they had WIC, so aid for women and children, right? And so the really important contribution that these researchers made, economists like myself, is that they were able to use California data and merge in, I think, tax records or something similar, so that we could understand the links between income and these adverse reproductive health outcomes. The tricky part is that the income gap is far smaller than the wealth gap in our country. And this is where we need to have a conversation about structural racism, not even just slavery, but the fact that even post-slavery, racist government, all kinds of institutions really collided to prevent Black people from acquiring wealth and being able to pass that wealth down from generation to generation. And you might ask, well, why is wealth important? We saw that with the COVID pandemic, right? Wealth is a thing that allows you to not work and still be able to survive and even thrive. And many of the people that had the least wealth were our essential workers, the ones that did the work that allowed us to stay home and stay safe with our families. So that paper looked at income, but we have yet, I think, to really look carefully at the relationships between wealth and outcomes. And I can say one more thing. I don't know if you want me to keep going on this, but there is one more thing that I did want to mention. There's a really great research article written by Dr. Cindy Colin at Ohio State University, where she uses longitudinal data to look at how childhood poverty affects birth outcomes. And she finds something really interesting. So white birthing people that grew up in poverty and were able to leave poverty in adulthood had lower rates of low birth weight relative to their counterparts that couldn't leave. The same was not true for Black birthing people. And I think that really speaks to this question of wealth, which we aren't able to measure as well as we'd like in existing data.
When we come back, Tiffany, I want to talk more about abortion and social justice.
Hi, I'm Ron Reagan, an unabashed atheist.
When I first recorded that commercial back in 2014, being openly atheist in America was still fairly uncommon. Today, the fastest growing religious group in the country is the non-religious, especially among the young. That progress is heartening, but the religious pushback is fierce and the forces of Christian nationalism are well organized. Our progress won't continue unless we work together so that reason and our secular constitution will prevail. That's why I'm asking you to join the Freedom from Religion Foundation, the nation's largest and most effective association of atheists and agnostics working to keep state and church separate, just like our founders intended. Please join the Freedom from Religion Foundation today. Ron Reagan, lifelong atheist, not afraid of burning in hell.
My name's Jarvis, and I'm an out-of-the-closet atheist. There are many reasons why I'm an atheist, but I'll start with the crudest explanation. I'm sure many of you have seen Clash of the Titans or The Immortals or 300, these blockbuster films about ancient Greek or Roman religion, which we now call mythology. But back then it wasn't mythology. It was very real for them. They genuinely believed that you had to put a coin in a person's mouth before they were buried so that they could pay for the literal ferry to the afterlife. Just as many people today believe that they should eat crackers and wine on a Sunday, or that God wants women to hide their bodies under black burqas. Every religion that has ever existed, and there are many, have all believed that they were right, that their rituals and rules and beliefs were 100% correct, and they all thought they nailed it. But where are they today? If they're not completely forgotten, they're on the silver screen, amusing us with their sword fights, animal sacrifices, and oracles. The religions of today are the entertainment of tomorrow. Everyone, I hope, is an atheist about Zeus and Apollo, Juno and Poseidon. I just added Jesus and Muhammad to that list.
I'm Annie Laurie Gaylor, and my guest today is Professor Tiffany Green, who's in the Departments of Health Sciences and Obstetrics and Gynecology at the University of Wisconsin. Dr. Green is an economist, pop health scientist with expertise in reproductive equity. So, Dr. Green, I turned on MSNBC last week, and I was very excited to see you. They're being interviewed about the perilous abortion situation here in Wisconsin. And I wonder if you could explain what that situation is for viewers who may not know what's going on here.
Sure. In Wisconsin, after Roe fell, after Dobbs v. Jackson Women's Health, the Supreme Court decided that the right to an abortion was not guaranteed in the U.S. Constitution. And because of that, Wisconsin reverted to a law that had been passed in the 19th century to prevent anyone from having an abortion. So providers cannot give someone an abortion unless the pregnant or birthing person's life is in danger.
And there's been a great deal of consternation and debate by physicians who are afraid, that they'll get put in jail for 6 years if someone disagrees with them. Isn't that right?
Absolutely, and I think that it has caused a lot of confusion. We've heard some stories that have been reported in the newspaper about people that have life-threatening situations, and doctors were very uncertain sometimes about whether they could provide the care that was required. I do want to say that although there's been a rightful focus on the effects of Dobbs on all these outcomes, Wisconsin was many people in Wisconsin were in a post-Dobbs world far before the actual decision. Wisconsin has a disproportionate share of the population that has to get care at Catholic health facilities. And what that means is that they cannot, as you know, better than I do, they cannot get reproductive health care. That is a standard, right? And I think that is really important. So here's where you have religious beliefs that are interfering with the right of Wisconsin people, residents who can get pregnant, to have full spectrum reproductive health care. And we're not even talking about abortions here. Most abortions are provided in private clinics. But here, people can't even get things like certain things like IUDs. I remember when I was giving birth back in another state, I had a great doctor, and she said, look, I have admitting privileges at this Catholic hospital, but just know that I cannot give you, say, an IUD, for example, if you deliver there. So that was, I think, really my first education about how damaging having religious institutions be able to impose their ideas about what constitutes reproductive health care or the right amount of reproductive health care on the population.
And I learned something when I was listening to you on MSNBC about the abortion ban in Wisconsin that somehow I didn't know. You talked about how it was passed in 1849, but when it was first passed, it wasn't as draconian. Is that right?
Yes, I was doing some preparation and reading in preparation for that interview, and something told me, go ahead and read the history. And there was a great write-up, I think, is it the Wisconsin Legislative Bureau? I can't remember off the top of my head, but it really traced the history of that law. And I think what's important to remember is that we can't necessarily impose our modern ideas of pro-life and pro-abortion on that time period. What happened was Wisconsin was a newly formed state, and they were trying to standardize laws around everything. So they borrowed the language from their laws from states like New York, and these states are following what is standard precedent in British common law, that an abortion is not really an abortion until you get to the point where the fetus is quickening. You have to remember, we didn't even know, and I know to identify the pregnancy hormone, HCG, until 1920. So the way that you knew that someone was pregnant was when you felt the fetus move. And those of us who are aware, who have been pregnant, know that that's about 4 to 6 months. So that original ban only covered abortions past that first half of pregnancy, right? So I think that's really important. And it's also really important to understand why that law became more draconian. And it was because of the American Medical Association. At that time, doctors were not particularly well respected. It was sort of a really blatant attempt to try to carve professional boundaries and gatekeeping around birthing, right? This had traditionally been a woman-dominated field. And one of the things that they decided was that they did not want to be associated with abortion. And so it was these doctors that started to spread this idea that life began at conception, when that was not, in any case, what the general idea was before then. So I think that's really important to understand that this Wisconsin had some particular leaders in this movement, but this was really reflective of a national movement started by doctors, including the AMA in particular, to try to establish their own own gatekeeping and really cloak it under the language of science.
So talking about reproductive justice and equity, these abortion bans, like the one we have in Wisconsin and at least 13 other states, are disproportionately affecting Black individuals, are they not?
Yeah, so we know that, for example, Black people who can get pregnant they form a disproportionate share of the population that gets abortions. And unsurprisingly, experts have predicted, for example, that pregnancy mortality, what we're here to talk about, is going to go up as a result of these bans. And the predictions are that they're going to disproportionately affect pregnancy-related mortality among Black people who can get pregnant.
So as this is being recorded, we're waiting for a Trump-appointed Christian nationalist judge in Texas to probably say he's going to ban mifepristone, which is part of the two-pill protocol for medication abortion. Briefly, can you comment about what that would mean, the attacks against medication abortion and what they mean for people in this country?
I think it's important to put into context. I'm grateful that I have so many legal scholars that I follow on Twitter. Despite all the challenges with Twitter, it's a great place if you have some discernment to follow experts. And what those experts seem to suggest is that this judge is clearly a handpicked judge that is trying to, the story is that they're trying to ban mifepristone, but that's, according to my legal colleagues, that's not going to necessarily happen. So what do I mean by that? There is a procedure by which the FDA recalls a drug or medicine. And the claim from the plaintiffs is that the FDA approved this medicine in a way that was not appropriate. And this is a very thin case. It's actually a laughable case. And the only reason it's getting an audience is because of this handpicked judge. The judge can order that the FDA pull it off the market, but they don't necessarily have to follow his procedures. I think the larger issue with this decision is that just as Roe died from a death by 1,000 cuts, this kind of approach that anti-abortion forces are going to use to try to chip away at access to abortion in general, just as because they realize that, oh, okay, Roe died, but what about medication abortion? They've been very clear that this is their next target. And I think that the case should be viewed in a light of that, and not necessarily that once this judge makes a ruling that he'll have the power to unilaterally pull mifepristone off the market. The second thing I wanted to say is that it's very, both of these drugs have been very studied, mifepristone and misoprostol. Misoprostol actually was discovered by Brazilian women who found that it was an abortive agent. And they were the ones who have been using this for some time. And we know that misoprostol is a safe and effective approach. But the reality is that mifepristone also is a tool in doctors' arsenals, and we should not be telling doctors how to do their job. Mifepristone is particularly important, not just for medication abortions, but for people that have miscarriages and need proper care. Mifepristone is an important player in being able to provide those people with proper post-miscarriage health care.
Yes, what we don't need is any more judges practicing medicine without a license. And thank you so much, Tiffany Green, for joining me today and for all your good work.
It was great to be here, and thank you so much for having me to talk about some of these important issues.
And thank you for watching Freethought Matters, because Freethought matters.
Hi, I'm Steve Pinker. In my book, Enlightenment Now, I show that the world has become a better place as reason has been overcoming superstition and tribalism. But the values of the Enlightenment are under attack. That's why I'm a proud member of the Freedom from Religion Foundation, the nation's largest association of free thinkers working to keep state and church separate. Please join me in supporting the Freedom from Religion Foundation to ensure that our government is driven not by religion, but by reason.